Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Pulmonary embolism. Introduction. A pulmonary embolism, or PE, is a sudden blockage in an artery of the lung. It is usually caused by a blood clot in the leg that breaks loose and travels through the bloodstream to the lung. A pulmonary embolism is a serious condition that can cause permanent damage to the affected lung, low oxygen levels in your blood, and damage to other organs. Serious pulmonary embolisms can cause death. This program reviews the symptoms and causes of pulmonary embolism. Information about the diagnosis and treatment of the condition are also presented. Anatomy. There are two types of blood vessels in the body. Those that carry blood from the heart to the body are called arteries. Those that return blood from different parts of the body to the heart are called veins. Blood can form clots to help stop bleeding when the skin or an internal organ is injured. Clots can also form inside the body and blood vessels. A clot that forms in one part of the body and travels in the bloodstream to another part of the body is called an embolus. The lungs and breathing system are called the pulmonary system. A clot in the lungs is called a pulmonary embolism. The arteries going to the lungs get progressively smaller. This allows the carbon dioxide to leave the blood and go into the air we breathe out. It also allows the oxygen to enter the blood from the air we breathe in. A blood clot that blocks an artery in the heart causes a heart attack. A blood clot that blocks an artery in the brain causes a stroke. A pulmonary embolus blocks one or more arteries in the lung. Pulmonary embolism. A pulmonary embolism, or PE, is a sudden blockage in a lung artery. The blockage is usually caused by a blood clot that travels to the lung from a vein in the leg. PE is a serious condition that can cause damage to the lung. This is because the part of the lungs that is fed by the blocked artery dies. PE also decreases the capacity of the blood to pick up oxygen. Since the blood picks up less oxygen, the body will have a low oxygen level. This in turn can damage other organs, such as the heart. The heart will have to work harder to pump more blood so the body can get the oxygen it needs. A big clot that blocks a larger artery in the lungs can be fatal. A small clot may not be fatal, but may still cause significant damage. PE most often is a complication of a condition called deep vein thrombosis, or DVT. In DVT, blood clots form in the deep veins of the body. It happens most often in the legs. These clots can break free, travel through the bloodstream to the lungs, and block an artery. If left untreated, about 30% of patients who have PE will die. Most of those who die do so within the first few hours of the event. A prompt diagnosis and proper treatment can save lives and help prevent the complications of PE. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Symptoms of a pulmonary embolism, or PE, include unexplained shortness of breath, problems breathing, chest pain, frequent coughing or coughing up blood, feelings of anxiety or dread. Sometimes the only symptoms are the ones related to deep vein thrombosis, or DVT. DVT symptoms include swelling of the leg or along a vein in the leg, pain or tenderness in the leg. See your healthcare provider right away if you have any symptoms of PE or DVT. It is possible to have PE and not have any symptoms. Causes and risk factors. Blood clots can form in the deep veins of the legs if blood flow is restricted and slows down. Deep vein thrombosis can happen if you don't move around for long periods, such as after some types of surgery, during a long trip in a car or airplane, if you must stay in bed for an extended time. Blood clots are more likely to develop in veins damaged from surgery or injured in other ways. The risk of PE increases with age. For every 10 years after age 60, the risk of having PE doubles. Your risk for PE is high if you have a history of deep vein thrombosis. You are also at a great risk of PE if you have had pulmonary embolism in the past. Other factors can also increase the risk for PE, such as being bedridden or unable to move around much, breaking a bone, conditions that thicken the blood, some of which are hereditary, having certain diseases or conditions such as chronic heart disease or high blood pressure, smoking. Women who take hormone therapy pills or birth control pills also are at increased risk for DVT. Diagnosis. To diagnose PE, a healthcare provider will ask about your medical history and perform a physical exam. He or she may also order other tests. A CT scan may be done to look for blood clots in your lungs and legs. An ultrasound or Doppler test can create pictures of blood flow in the body. Ultrasounds of the legs show blood clots in the veins of the legs. A lung ventilation perfusion scan, or VQ scan, uses a safe radioactive substance to show how well oxygen and blood are flowing to all areas of your lungs. Pulmonary angiography is another test used to check for PE. A flexible tube is threaded through the upper thigh or arm to blood vessels in your lungs. Dye is injected into the blood vessels, allowing X-ray pictures to show how blood flows through the blood vessels in your lungs. Various blood tests may also be ordered. An MRI may be done to take detailed pictures of areas inside your body. Treatment. The main goals of treating PE are to stop the blood clot from getting bigger and keep new clots from forming. Depending on the condition, your healthcare provider may recommend medicine, surgery, or other therapies. Often, treatment includes medicines to thin the blood and slow its ability to clot. If your symptoms are life-threatening, your healthcare provider may give you a special medicine to quickly dissolve the clot. Rarely, your healthcare provider may recommend surgery or another procedure to remove the clot. If you can't take medicines to thin your blood, or if the medicines don't work, your healthcare provider may suggest a filter placed inside the vein that carries blood from the lower body to the heart. This filter keeps blood clots from traveling to your lungs. Graduated compression stockings can reduce the chronic or ongoing swelling that a blood clot in the leg may cause. These stockings are tight at the ankle and become looser as they go up the leg, causing gentle pressure up the leg. This keeps blood from pooling and clotting. Preventing pulmonary embolism. Preventing pulmonary embolism begins with preventing deep vein thrombosis. Knowing whether you're at risk for DVT and taking steps to lower your risk are important. To prevent DVT and PE, it is important to exercise your lower leg muscles if you're sitting for a long time while traveling. You should also get out of bed and move around as soon as you're able to after having surgery or being ill. You can also take medicines as prescribed by your healthcare provider to prevent clots after some types of surgery. Be sure to follow up with your healthcare provider to confirm what you are doing is preventing the clots. If you've already had DVT or PE, you can take more steps to prevent new blood clots from forming. Visit your healthcare provider for regular checkups. Also, use compression stockings to prevent chronic swelling in your legs from DVT as advised by your healthcare provider. Contact your healthcare provider right away if you have any signs or symptoms of DVT or PE. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. A pulmonary embolism is a sudden blockage in a lung artery. The cause is usually a blood clot in the leg that breaks loose and travels through the bloodstream to the lung. This is called deep vein thrombosis. A pulmonary embolism is a serious condition that can cause permanent damage to your lungs, damage to your other organs, and poor blood circulation. It can also cause death. Symptoms of a pulmonary embolism, or PE, include chest pain, feelings of anxiety or dread, frequent coughing or coughing up blood, problems breathing. Sometimes the only symptoms are the ones related to deep vein thrombosis, or DVT. DVT symptoms include swelling of the leg or swelling along a vein in the leg, pain or tenderness in the leg. The main goals of treating PE are to stop the blood clot from getting bigger and keep new clots from forming. Depending on the condition, your healthcare provider may recommend medicine, surgery, or other therapies. To prevent DVT and PE, it is important to exercise your lower leg muscles if you're sitting for a long time while traveling. You should also get out of bed and move around as soon as you're able to after having surgery or being ill. Thank you for using Explain.